Hi, I'm Zach Levin.
And I'm Natalie Raper. Welcome to MAHEC. We're excited to have you here.
We're here today to go over a few important things before you begin your time here at MAHEC.
Our goal today is to ensure you're familiar with some important policies, procedures, and for you to get an overall feel for the culture and mission at MAHEC. We hope you enjoy the show. Welcome to Mountain Area Health Education Center's basic training course. There are two parts to this presentation. Part 1 is for all affiliates, and Part 2 is a continuation for clinical personnel. MAHEC's mission is to train the next generation of healthcare professionals for Western North Carolina through quality healthcare, innovative education, and best practice models that can be replicated nationally. We value excellence, innovation, compassion, and collaboration. Our culture is defined by our civility. These three items should be very important to you during your time here at MAHEC. MAHEC has many policies governing our work and employees. The next few slides address just a few policies that our affiliates should be familiar with. Please connect with your supervisor or team leader regarding any questions that you have about MAHEC policies. Don't forget that all policies can be found on the MAHEC intranet under Publications for those that have access. The dress policy. All affiliates are expected to dress in clean professional attire. Clothing must not be excessively tight, revealing, ripped, torn, bleached out, or tattered. Backless sandals and flip-flops are not permitted. This is to ensure a safe work environment compliant with OSHA and infection control standards. Create and maintain a workplace environment free from unnecessary distractions caused by inappropriate personal appearance and to present a professional image to our patients, visitors, customers, and peers. Some examples of appropriate attire include slacks, khakis, capri pants, suits, sport coats, blazers, jackets, cardigans, and sweaters, skirts, and dresses, which should be 4 inches above the center of the kneecap or longer, blouses, turtlenecks, shirts with collars, and polo shirts. The nepotism policy for MAHEC encourages a collegial and supportive atmosphere at work for its employees and affiliates. Interpersonal relationships between employees may become a concern if they have the effect of impairing the work of any employee or affiliate, harassing, demeaning, or creating a hostile work environment for an employee, or just creating doubt in the reliability, trustworthiness, equitability, or sound judgment of the persons involving in the relationship. The following conduct is prohibited and violations will result in appropriate disciplinary action. Unlawful manufacture, distribution, dispensing, possession, or use of a controlled substance is prohibited in any MAHEC workplace. Being under the influence of or impaired by alcohol or an illegal drug while performing MAHEC business, while driving a MAHEC vehicle, or while on MAHEC property. Consumption or possession of alcoholic beverages while on duty or on MAHEC property. The following detail MAHEC's testing procedures. No pre-employment screening unless authorized or required by contractual relationships with community partners. There's no randomized screening process. And reasonable suspicion testing primary method of testing. MAHEC's productive workplace and sexual harassment policy. Affiliates should be able to work and learn in a safe stimulation atmosphere. All affiliates have a responsibility to report discrimination and or harassment. Any affiliate or employee who feels that an individual has violated this policy should directly address the unwanted behavior, report the incident to the Director of Human Resources. If the case does involve a member of HR staff, report it directly to the Chief Compliance Officer. We strive to create and maintain a work environment in which individuals are treated with dignity, decency, and respect. The environment of the organization should be characterized by mutual trust and the absence of intimidation, oppression, and exploitation. MAHEC supports and promotes an environment that is responsive to issues of safety, loss prevention, and risk management. All affiliates should be involved in identifying incidents that could endanger the health and safety of our patients, employees, customers, and visitors. An incident can be defined as any event involving a patient, visitor, staff member, equipment, or facilities which may affect the quality of patient care, safety of the practices, or create the potential for a liability claim. Here are some examples of when to complete an incident report and how to report an incident. Near misses, vehicle accidents, adverse outcomes, and so forth are always items that you want to report as an incident. So why does MAHEC have a compliance program? Because it's the right thing to do, and we're mandated by the federal government and the Office of the Inspector General. Our compliance program outlines what employees need to know to comply with federal and state laws, specifically with Medicare and Medicaid. We also need to work really hard to prevent, detect, and correct wrongdoing and to mitigate the risks of our organization. MAHEC Standards of Conduct. MAHEC Standards of Conduct are guidelines regarding ethical and legal standards employees are expected to follow when performing services for or on behalf of MAHEC. These include compliance with the law, anti-kickbacks, self-referrals, and antitrust, billing and coding standards, conflicts of interest, confidentiality of patient information, environmental health and safety, and asset protection. So who do you call? All affiliates have a responsibility to report discrimination and/or harassment. Any affiliate or employee who feels that an individual has violated this policy should contact their supervisor or team lead, email the Chief Compliance Officer, call Compliance Assistant Line at 257-4428, report via an anonymous email to Corporate Compliance on MAHEC intranet. And you can see here's a screenshot of where the corporate compliance area lives on the intranet. So what is PHI? PHI is any information that can be used to identify a patient, whether living or deceased, that relates to the patient's past, present, or future physical or mental health condition, including healthcare services provided and payment for those services. PHI can be oral, written, or electronic. Below is a list of all things considered PHI: patient names, fax numbers, email addresses, pictures, employer, subdivisions, names of relatives, vehicle identifiers are all included. Generally, a patient's authorization is required for the use minimum necessary to accomplish the intended purpose for disclosure. It is never acceptable for anyone to look at PHI just out of curiosity or for a non-job related reason. Only access or disclose a patient's PHI when this access is part of your job duties. A few things about cybersecurity. MAHEC Information Technology, also known as IT, will never ask for your password over the phone or email. They will only reset your password at your request to assist you. They will always properly identify themselves as they enter your department. They will escort technology-related vendors throughout the organization and introduce them accordingly, and they will always wear their badge that identifies them as a MAHEC employee. So what is cybersecurity? Cybersecurity is a body of technologies, processes, and practices designed to protect networks, computers, programs, and information from attack, damage, or unauthorized access, protecting confidentiality, integrity, and availability of the data. A data breach is an incident in which sensitive, protected, or confidential data has potentially been viewed, stolen, or used by an individual unauthorized to do so. Data breaches happen every day. Just check the news. It's everyone's job to protect the data of MAHEC. The biggest threat to cybersecurity at MAHEC is humans. Our biggest asset is you. What is phishing? Phishing is the fraudulent practice of sending emails pretending to be from a reputable company in order to manipulate individuals to reveal personal information, such as passwords and credit card numbers. How would you detect a phishing attempt? You should check for spelling mistakes and grammar mistakes. Check for poor use of the English language. Beware of urgent or threatening language. Be sure to review the subject and signature lines. Make sure you hover over any links before clicking. Don't click on attachments from unknown sources, and don't believe everything you see. Delete any request immediately for health and financial information or passwords. Some password best practices during your time here at Mahek. Use strong passwords at all times. Include the following in your passwords: an upper and a lowercase letter, numbers, and symbols. Mahek enforces an 8-character minimum for passwords. Mahek enforces a 90-day password frequency change. Try not to use a single dictionary word if possible. Use sentences rather than single dictionary words. Longer passwords are better. Substitute letters for numbers and symbols if you can. Examples are below. And don't write your password down, ever. Last but not least, don't share your password with anybody. It's for your eyes only. So what do you do if you accidentally click on something? Don't try to cover it up. Covering up leads to bigger problems. Call the Mahek Help Desk to report the situation so we can investigate. The phone number is 257-4480. You can also email the help desk at helpdesk@mahek.net. Even if you think it's minor, let IT investigate it just to be sure. Portable media. Portable media includes USB drives, external hard drives, CDs, and DVDs. Make sure you try to avoid using these unless they're absolutely necessary. Look to store your data on network drives rather than transport via portable media, especially if it's sensitive data. If you find portable media and do not know its origin, do not try to access it on a computer. Give the portable media to the IT department for proper investigation. Now for some items about safety. North Carolina is governed by North Carolina Occupational Safety and Health. NCOSH enforces state OSHA standards. Safety data sheets and HAZCOM. Mahek maintains a chemical inventory and associated safety data sheets for all of the hazardous chemicals used throughout our facilities. Some of these have the potential to cause fires or other serious accidents. Chemical exposures may also cause or contribute to health problems such as lung damage, cancer, sterility, and even death. Because of this, Mahek maintains a chemical inventory and associated safety data sheets for all of the chemicals used throughout our facilities. Personal protective equipment, or PPE, is extremely important whenever you are working with chemicals. It is critical to know the route of entry, which means the way in which a chemical might enter your body, for the chemical that you're working with. Inhalation, which means absorption through the respiratory tract via breathing. That means you must wear a mask. Injection, absorption through the digestive tract. That means keep food away from your work area and wash your hands thoroughly before eating or drinking. Injection, introducing the material directly into the bloodstream. Injection prevention means safe injection practices. Skin contact, absorption through the skin. That means wear your gloves and your scrubs. Eye contact, splashes in your eyes. Wear your safety glasses, goggles, or face shields. Some things you need to know about biohazard safety and sharp safety. The following precautions should be taken when working with potential biohazards. Always wear the appropriate PPE. Label waste contaminated with blood or body fluids. Labels should be placed on containers, refrigerators, material, containers used to store, transport, or ship, or other potentially infectious material. For sharp safety, injuries can occur because of the following: passing or transferring equipment, recapping contaminated needles, colliding with coworkers, decontaminating processing used equipment. Injuries occur from sharps left in unusual places, laundry, mattresses, tables, trays, and other surfaces. Always exercise caution when working with contaminated sharps. If there is a fire, activate the fire alarm with a pull station on the Biltmore campus. Announce location of the fire in the satellite clinics and offices, and use the RACE acronym. R stands for Remove Patients, Visitors, and Personnel. A stands for Activate the Fire Alarm and Notify Others. C stands for Contain the Fire and Smoke and Close the door to the fire area. E stands for Evacuate. Extinguish the fire only if it's small and you have a clear path to evacuate. The evacuation procedure at Mahek is to evacuate the building, go to the meeting place, front parking lot for any Mahek office, check in with your supervisor, and remain with the group until you receive the all clear. Emergency preparedness. In the case of a tornado or severe weather, facilities management will determine if a warning has been activated. Head to a shelter location and remain there until you are given an all clear from facilities management. Seek suitable shelter locations at MAHEC facilities. Interior exam rooms, conference rooms, offices, or bathrooms are acceptable. If you come upon an unresponsive person, dial 911. Send someone to find a physician while someone stays with the unresponsive person. Proceed with emergency response, which is CPR or using a defibrillator. If you come across an angry or combative person with no visible weapon, diffuse the situation using a calm voice. Be empathetic. Call 911 if the situation escalates or you feel threatened. And last but not least, if you come across an angry or combative person with a weapon, call 911 or activate a silent panic button. Run, hide, or fight. If you experienced a needle stick or sharps injury or were exposed to the blood or other body fluid of a patient during the course of your work, immediately follow these steps. Wash your injury site with soap and water. Flush splashes to the nose, mouth, or skin with water. Irrigate your eyes with clean water, saline, or sterile fluids. Report the incident to your supervisor and risk management. Complete an incident report. Submit your incident report to risk management and then wait for risk management to provide you with additional instructions. Some points of contact for you during your time here at MAHEC: facilities, compliance, the IT help desk, human resources, and risk management. This completes part 1 of Mountain Area Health Education Center's Basic Training Affiliate Orientation video. Thanks so much for watching. In regards to the clinical and OSHA walkthrough, a few things you need to know. As part of your orientation process, you will need to complete a building walkthrough with your supervisor or team lead that covers the building-specific emergency and safety information. A MAHEC staff member will guide you on the walkthrough. And here you can see the form with all the areas that you'll be touching on during the walkthrough. Here are a few high-priority infection prevention practices that MAHEC follows very closely. The key practices to ensure patient and employee safety include hand and respiratory hygiene, safe injection practices, wearing appropriate PPE, and proper disinfection and sterilization. The most important of these is hand hygiene. MAHEC uses the rule of 6 to identify when hand hygiene is appropriate. Before touching a patient, even if gloves will be worn, before exiting the patient care area, after contact with blood, bodily fluids, excretions, and wound dressings, prior to performing an aseptic procedure, like administering an injection, when moving from a contaminated to a clean body site during patient care, and after glove removal at any point. Some cough etiquette you need to keep in mind. Cover your mouth and nose with a tissue when you cough or sneeze, or cough or sneeze into your upper sleeve, not your hands. During cold and flu season, all MAHEC work areas should be stocked with tissues. Studies tracking dispersal of droplets when sneezing show that the most effective way to prevent the spread of germs is to cover your mouth and nose with a tissue when you cough or sneeze. Alternatively, cough or sneeze into your upper sleeve in a direction that is away from others. I like to call this the vampire sneeze. Always use hand sanitizer to clean your hands after coughing or sneezing, and as needed, use warm water and soap to clean off any droplets. Some safety steps for injections. Some affiliates may be performing clinical work like injections, so MAHEC follows the CDC's 1 and 1 only guidelines to prevent transmission of infection to patients. In the ambulatory healthcare setting, the primary source of Hep B and Hep C transmission to date has been due to errors in safe injection practices, specifically reusing needles and syringes, reusing single-dose vials, and exposing multi-dose vials to cross-contamination by bringing them into patient care rooms. At MAHEC, always use a new needle and syringe for every injection. Always discard single-dose vials after one use and double-check expiration dates. Do not use if the medication is beyond the date. And Always draw up medications at the nurse's station in the specific area. Never bring multi-dose vials into the patient care area. If this is done, it should be discarded. And as with single-dose vials, always double-check expiration dates. Let's talk about medication labeling. Medications drawn up for injection should be labeled with the time of the draw, initials of the person drawing up the medication, name of the medication, strength of the medication, and the expiration date if it's not printed on the vial. Medication syringes should not be carried in personal clothing or pockets. When you are administering an injection that you have not drawn up, you want to verify this key information. If the person providing you with the injection was the person to draw it up, you must do a verbal check with them rather than reviewing the label. Some key items to remember for personal protective equipment. Always wear the appropriate PPE to prevent infection. The order of putting on PPE begins with a gown, then the mask, with or without the face shield, then goggles, and finally gloves. When removing PPE, do it in the reverse order and dispose of it in regular trash bins unless it is saturated with blood or other bodily fluids. Disinfection and sterilization. All members of the care team are responsible for making sure that the equipment used is disinfected after each use. At Mayhec, we use CaviWipes 1 and CaviCide 1. The surface that needs disinfection must be wiped and left wet so that the drying time is 1 minute. Items that need disinfection could include stethoscope bell, blood pressure cuff, all surfaces in the patient exam room, table, chairs, counters, and the fetal Doppler. Sharps injuries are preventable. It only takes a second for an injury to occur. The consequences can be significant. Hep B transmission could occur, hepatitis C, or HIV transmission. And the most effective tool against a sharp injury is your attention and focus. We encourage all providers and staff to be aware of their capacity to prevent needle sticks and sharps injuries. Taking time to breathe and focus on the tasks that involve using sharps can save your days of worry, health concerns, and in some cases, significant infection. Some sharps prevention practices that Mayhec follows. Be sure to assess the patient's ability to cooperate and ask them not to make any sudden movements. Keep visual contact with the sharps at all times. Keep awareness of others nearby. Keep a neutral zone for placing and retrieving sharps. Do not hand pass contaminated sharps from one person to another. If you need to pass an uncontaminated sharp, be sure to alert others around you. Activate the safety feature as soon as the sharp is used. And locate sharps containers before you begin using them. Make sure there's one nearby. 75% of all sharps injuries occur when attempting to pass a needle. Sharps containers should be replaced once they are 3/4 full. Do not attempt to place a sharps in an overfull sharps container. Let's talk about TB. What do you need to know? Mayhec is at a low risk for TB exposure. If a person with suspected or known TB comes into the clinic for care, be sure to notify your supervisor. Most people infected with TB do not get sick because their bodies are able to stop its growth. Following a TB exposure, Mayhec will report the incident to the Buncombe County Department of Public Health and work with Buncombe County to evaluate the potential source of exposure and make plans for follow-up as needed. Lastly, let's talk about crash carts and defibrillator locations. Automated external defibrillators, aka AEDs, are housed in every Mayhec facility and could possibly save a life in the event of a heart attack or other medical emergency. Here are where the AEDs are kept in Mayhec's facilities. There's one in the Family Health Center satellite campuses. They're on the crash carts in the clinical areas. At Ridgefield, near the bathrooms. At our OBGYN facility, those are also in the crash carts on the first and second floors in the clinical areas. In the education building, next to the registration counter in the hallway between the commons and the front desk, that's on the first floor, and then in the fitness center on the ground floor. In family health centers and the Biltmore Clinic, on the crash cart in the clean room near the West Nurse Station on the first floor, and in the dental health center in the cabinet outside the sterilization room on the second floor.